This portion of CardioSource Video News is brought to you by Medtronic.
There are several clinical trials at TCT 2010 that reflect comparisons between different types of stents. In the Excellent trial, the everolimus-eluting stents and the sirolimus-eluting stents go head-to-head. My colleague, Dr. Peter Block, has the latest.
Thanks, Randy. I'm here with Dr. Hyo-Soo Kim from Seoul, Korea. Dr. Kim has just presented the results of the Excellent trial, yet another trial comparing stents. So, Dr. Kim, tell me what the Excellent trial really was, and then what did you find, of course?
The primary objective of Excellent RCT is to compare the safety and efficacy of Xience Promus versus Cypher Select. We collected about over 1,400 patients and randomized them into Xience Promus versus Cypher Select with a ratio of 3:1. And our primary objective was to compare the in-segment late loss and in-stent late loss between two stents. And as a secondary endpoint, we also analyzed the clinical outcomes between two stents.
Now, there have been a lot of comparison trials between stents, of course, so this is yet another one. Is there something specifically different about this one?
This is an angiographic study, so we can get the information of late loss between two different stents. This is the first study. The main finding of our results is late loss of Xience Promus is about in stent 190 micrometer, whereas it is about 150 micrometer in Cypher Select, which was not different between two stents. In other words, Xience Promus was not inferior to Cypher Select in terms of in-stent and in-segment late loss.
So this is a non-inferiority trial. Is that the way it was designed?
Yes, we calculate the sample size on the basis of non-inferiority test.
Okay, so let me ask you the clinical question. Suppose you needed to have a stent. Would it bother you to have either one of these two stents? Would you say they truly are equivalent, or would you choose one versus the other?
So there is slight difference of late loss between two stents, but such a mild difference of late loss between two stents does not lead to a difference of clinical outcomes because of very narrow difference of the late loss between two stents. But in diabetic subset, the late loss difference between two stents slightly increased up to 110 micrometer, which negates non-inferiority. In other words, in diabetic subset, late loss of Xience Promus may be inferior to Cypher Select, but still, such a kind of mild difference between two stents in late loss does not reflect difference in clinical outcomes.
Okay, so there you have it, the Excellent trial. Thank you very much, Dr. Kim.
Thank you very much.
Medtronic proudly introduces Integrity BMS, now available in the U.S. Visit MedtronicStents.com for more information.